I decided I wanted to be an interventional cardiologist in a roundabout way. I ended up spending some time in a hurricane shelter as a volunteer. I got assigned through the Red Cross to work with a physician. Working with her and seeing which patients needed attention and being able to do what she was able to do with so little resource at the time was really inspiring. I also came about cardiology itself kind of accidentally. I ended up going down to Duke to study internal medicine and do my residency there, and I worked with more cardiologists there in clinical trials, and the rest is history. That's how I got into cardiology. One of the most exciting things about being involved both with clinical research and interventional cardiology is that the ground is constantly moving under us, because the things that we knew and learned and even taught as faculty members 1 year ago, 5 years ago, we're now doing different things, and we now have even stronger therapies and even better techniques to help people live better, longer, healthier lives. One of the misconceptions about interventional cardiology is that everything we do is scary and risky, and we certainly are some of the ones who take on some of the toughest cases, but it actually turns out that most of our procedures not only are safe and effective, but quite low risk. We're looking at survival rates that are the best we've ever seen in the history of medicine. You know, patients really are at the center of the decision-making process, but the important thing is to understand, who is this person as a person? That gives a lot of context to our decision-making process, probably more than anything we get from the scans or from these technical and wonky things that we look at all the time. They marry in an important way, but understanding who this person is as a person before we understand who this person is medically is the key. I'm Ben Peterson, an interventional cardiologist and researcher practicing at Intermountain Health.